Hi, I'm Erica Narducci. I'm the program director at Cancer Support Community Delaware. We are a nonprofit here in Delaware with offices in three counties, providing no cost support to cancer patients and their loved ones through in person and virtual support programs, which are provided as support groups, healthy lifestyle classes, and educational sessions like this today. March is Colon Cancer Awareness Month, and to help bring us a little education around what colon cancer is, the symptoms to look out for, and what we can do regarding screenings for this cancer, I've asked Dr. Evan Lipinski to join me today to answer some of these questions. So, Dr. Lipinski is a medical oncologist at Medical Oncology and Hematology Consultants at Christiana. So, thank you so much for being here today.
Thanks so
Um,
much, Erica.
and Dr. Lipinski, how long have you been at Mohawk, and what primary cancers do you see as in your patients?
Yes. So I've been with our practice for about 6.5 years, and I do focus on GI cancers. Certainly, colon and rectal cancers, as we'll talk about, are quite common, and I see a lot of patients with those specific types of cancers. I also see a lot of patients with pancreatic cancers, biliary tract cancers, liver cancers as well. And then I do see hematology and other general oncology patients and other tumor types as well. But I do have a specific interest and passion to take care of patients with GI cancers.
Great. So, as you can hear, they're very well qualified to answer some of my questions today. So, let's jump right in. Why is awareness about colon cancer so critical right now?
Yeah, well, as you mentioned, we're in colorectal cancer awareness month here in March, and so it's a good time to be talking about all of this. Just a few kind of basics. What are we talking about with colon and rectal cancers? These are cancers that arise either in the colon, which is the large intestine, or the rectum, which is the end part of the intestinal system. And the statistics around this are really why it's an important topic. It's the third most common cause of cancer in both men and women in the US, and it's also the third most common cause of cancer death, unfortunately, in the United States. And one interesting projection, and we'll talk about the changing dynamics of some of the epidemiology and the statistics around colon and rectal cancers, but by 2030, there are some estimates or expectation that colon and rectal cancers may become the leading cause of death for men and women in terms of cancer-related deaths in America. So definitely a really important topic to talk about. Um, the other reason that I think we're talking more about it right now is the increasing incidence rates of cancer, of colon and rectal cancers in younger patients. So we're talking about patients under age 50. The data over the past 20 years has really shown us that the cancer rate, in terms of incidence, has gone up among patients who are under 50, probably by about 20 to 30%. And obviously, that's an alarming trend. And we're trying to understand more about that. There's research going on that I'll talk about in a little bit. Interestingly, the incidence rate for patients who are over 50 is generally flat or potentially kind of going down, I think, as a result of effective screening procedures for patients who are over 50. And we'll talk more about that in a little bit.
Okay. Great. So some good news there, but also some, maybe some troubling things. And when you say 2030, it makes me think, oh, that's so far in the future, but it's actually only 4 years away, which is
Exactly. I
amazing.
thought the same
So,
thing when I saw that statistic. I said, that's
yeah.
around the corner.
Right. So what are the most important symptoms of colon cancer that people should not ignore?
Yeah. I mean, I think, try to give a balanced view of this. On the one hand, not all these symptoms that I are going to talk through always mean cancer. So that's one important thing to keep in mind. But I think the things that, need to be reported to your doctor or your physician, include blood in the stool or bleeding with bowel movements. Obviously, that's never a normal occurrence and needs to be at least investigated by your healthcare professional. So that's clearly a red flag symptom. But other things, abdominal pain, nausea and vomiting, and then unexplained weight loss. Again, not always going to lead to a cancer diagnosis, but those are things that if they're ongoing and unexplained, are good reasons for you to talk to your healthcare provider. One other kind of way that a lot of colon and rectal cancers can get diagnosed is through anemia. Anemia is a blood condition where you have a decrease in red blood cells. And the reason for that is the linkage to cancers is that bleeding and over time blood loss, potentially through the stool from a colon or rectal cancer, could cause anemia and low iron levels. And oftentimes that's what gets flagged in patients when they go to the doctor and they're feeling tired or they're feeling lightheaded, or other symptoms of anemia, shortness of breath. So these are things that are linked to anemia, which could then be due to cancer somewhere in the GI system, and sometimes that's in the colon and the rectum. So, to summarize, if you're having symptoms, make sure they get addressed, and don't shy away from seeing your doctor for those types of things.
Great. And as we hinted at before, we're going to talk a little bit about screening. So, at what age should people start screening, and what screening options are available?
Yes, so screening incredibly important. There's screening tests for many different types of cancer, and there's a group, a task force that's called the U.S. Preventive Services Task Force, and they're a clinical and scientific body that reviews a lot of research that gets done on different screening techniques for various cancers. They're behind recommendations for mammograms and prostate cancer screenings and other things like that. In the colon and rectal cancer world, there are very clear guidelines that actually have changed fairly recently, to talk about when to start screening. For a while, the minimum age, the starting age for screening for patients who did not have family history or other specific risk factors was age 50. And now they have updated those guidelines, and the way that I interpret them, and most people do, they're recommending screening for all people, regardless of their family history or other risk factors, to start at age 45. And so that's an important update that some people may not know about, and is important that providers are making sure their primary care patients are being screened appropriately for colon and rectal cancer. And you also asked about, how are we doing that? What are the screening modalities, the screening tests? There are several out there, and the task force does list various options, and their goal is to screen the most amount, the most patients, and make sure that people get some form of screening. I think that's a worthy goal, but I do have, kind of a bias towards what we consider the gold standard of screening, which is colonoscopy. There are other methods, including, stool testing for occult blood, even if people aren't seeing black stools or red blood in their stools. And then, there are these newer tests that have been developed over the past decade or two. Cologuard is the most kind of widely marketed. That is a test that I think has benefits to it, but also, sometimes we do see, false negative results there. And colonoscopy, I think, remains, to me, and I think many in our oncology world, the gold standard, and that's done through a gastroenterologist typically, or a surgeon, that patients would see for that screening. So that's how I counsel my patients, that need screenings, or have had a prior colon cancer. I really encourage colonoscopy. I know there's a lot that goes into that decision for people whether to have it done or not, but having had one myself, I would say it's very temporary in terms of the preparation for it, and really not a big deal to undergo for most patients. I'll talk briefly. I mentioned that there are reasons to have screening done before age 45. Typically, the most common would be a family history of colon and rectal cancer, and generally If that's earlier in life, then we would start screening patients, under the before age 45, and there's some specific guidelines on that you can ask your doctor about. Other reasons would be, family inherited genetic syndromes or cancer syndromes that patients may be aware of, or other specific uh, gastrointestinal diseases where patients have increased risk for colon cancer and thus need increased screening. But to summarize, the minimum age, the recommended age is to start at 45 unless you fall into one of those other categories.
And I will echo your comment about I have had a couple colonoscopies. It's really not as hard as some people make it out to be. I feel the prep has really improved in over the years, and it really is worth the effort that you have to put in to
Yeah,
do.
great point that the prep has modified and really is not so onerous anymore.
Yeah. Um, so with the recent deaths of James Van Der Beek and Chadwick Boseman, both well-known actors, both from colon cancer, headlines are telling us we are seeing increased rates of colon cancer in younger adults. You mentioned it earlier yourself. So why is this?
Yeah, definitely troubling, and the public is definitely being made aware through these higher profile individuals, which is very unfortunate. Um, there are there the rate, the rise in rate of cancer in the younger patients. We try to detail out, is that potentially a genetic change, or are there more genetic syndromes or genetic mutations out there that could be inherited that is causing this, or is it potentially more based on lifestyle factors or environmental factors? I think the research is pretty clear that it's probably not, brand new genetic diseases that we didn't know about before, and patients having an increased risk because of newer genetic syndromes. There are some patients who are known to have higher risk of colon cancer due to Lynch syndrome and other cancer syndromes where multiple family members are affected. That's why it's important to know your family history, as I mentioned before. So it seems like there's probably more lifestyle, what we would call lifestyle factors. Not always, there's always some patients that come to me and have an early life cancer, and I have no great explanation sometimes, and it's bad luck. And the more we can listen to symptoms and screen patients, that's to our advantage. Um, but some of these lifestyle factors that are emerging, both through there's some research being done actually at the Helen Graham Cancer Center, which is where our medical oncology hematology consultant office is in Newark, um, that shows that there are probable impacts of changes in the Western diet over, say the last 50 to 75 years. Fattier foods, more red meats, processed foods. Those things I think are probably playing a role here. Smoking and alcohol are really risk factors for many cancers, potentially all cancers. And I think that is the case for colon and rectal, maybe not to the same degree that you think about it for lung cancer or other things, but certainly that's something that I counsel patients on, managing their risk factors. And then the obesity, the prevalence and the epidemic of obesity in America, and physical inactivity we know that increases people's risk for cancer overall. One interesting focus of research that's going on right now is the interaction between the body's intestinal system and the what we would call the gut microbiome, or the bacteria, good bacteria, if you will, that live in the gut. There's some research being done to see if maybe there are modifications that are happening to that are putting patients at risk for developing a cancer. So that's pretty, emerging still, but I think we'll talk a little bit in a minute maybe about, how I counsel patients on modifying their risk factors, but um, uh, we are awaiting more research, and that's being done, which is helpful. But for now, we know the trend, and we need to really be on top of watching for symptoms and encouraging screenings for all.
Good. Well, it is good to hear there is being research done. We are trying to figure out, how can we kind of slow this down. So good to hear. So as we start to kind of wrap it up, my last question is, what is the one message you want everyone to remember about preventing or catching colon cancer early?
Yeah. I think we've gone through some of that, and I'll summarize by saying number one, if you're over 45, make sure you're up to date with your screening. That's a clear, easy recommendation. Unfortunately, in what I do, I've seen, too many times there are patients that come to me and have never had a colonoscopy and they have a colon cancer. And I, just try to educate them so they maybe can help their family members or loved ones know the importance of screening. Um, for I would say patients who are under 45, and really all patients, listen to your body. If you're having symptoms, listen to that. Try to modify the risk factors that you have control over, things like, healthy body weight, diet, and exercise, limiting alcohol intake, avoiding tobacco products, and then smoking. Those are all, pretty clear, easy things you can do to control not only your cancer risk, but many other, risk factors for other diseases as well. And I think, to wrap up and give, one parting word, that we have a saying, if you see something, say something. I think that applies
Mhm.
here. If you see or feel something that just isn't right, talk to your doctor, your healthcare provider. That's why they're there, and they can, you know, evaluate you appropriately and make sure you get looked at in the right way. So that's what I would tell everyone, especially during Colon Cancer Awareness Month, make sure you know, as we've talked about, what to watch out for.
Great. Yeah, that's important for all of us. Stay on top of your screenings, advocate for yourself, control the things you can control, like your lifestyle. Great. So thank you so much for being with us today, Dr. Lipinski, and sharing this knowledge with us. We appreciate it.
My pleasure.
Um,
Thank you, Erica, for having me.
yeah. If you're not familiar with Cancer Support Community Delaware, you can find us on the web at cancersupportdelaware.org. Thank you.